conference. I'm Nancy Pollard. Joining us today is the Honourable Andrew Furey, Premier of Newfoundland and Labrador, my apologies. The Honourable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon, and thank you all for joining us. Well, Newfoundland and Labrador, you've done it again. Our vaccination rate for 5 to 11-year-olds is the highest in North America. Not only are we leading the country, it looks like we may have a world record in this demographic. Congratulations. It's simply amazing. About 80% of 5 to 11-year-olds have at least one jab, and will soon be at 30% fully vaccinated. Booster doses are barreling along as well as with roughly 260,000 boosters administered so far. Over 80% of those 70 and up have had their jab. Thank you to everyone involved in achieving these incredible milestones. Not only are you protecting yourself, you're protecting each other. With our impressive vaccination rates and the current COVID-19 situation in Newfoundland and Labrador, I'm sure many of you will be pleased to hear Dr. Fitzgerald share some further loosening of public health restrictions today. These changes, informed by science and evidence as always, will come into effect on Monday, with an adjustment to the guidance for faith-based gatherings starting in time for this weekend's worship services. As government, we recognize the value of competitive sports. I love to play hockey myself, or what I think is hockey, as some of my teammates would say, and I can't even begin to describe how much team sports mean to my kids. So we are particularly happy that Dr. Fitzgerald and her team in public health are more comfortable now with allowing competition next week, within the same region, of course, and to see, again, bigger gatherings happening across our province. Look, I know this is tough. I'm hearing from more and more of you lately that you're simply done with COVID. And trust me, we all want to be. Fortunately, because of the evidence, our epidemiology, and your hard work, we are able to open things a little faster than before, learning lessons in the past. We're entering our third year of living with the virus and all of the anxieties and hardships that it has caused. While we welcome a return to more normal sense of life, we also struggle with getting used to the concept that we must learn to live with COVID-19. The Omicron variant has presented a real turning point, coupled with the overwhelming effectiveness of vaccinations in preventing severe disease and hospitalizations. That may not make it easier, though, for parents and caregivers with very young children who are not yet eligible for the vaccine. Please know that we recognize your concerns and how difficult it must be for you to navigate exposures at childcare, your more vulnerable grandparents, and periods of household isolation. I'd hope it brings some comfort to know how successful our vaccination and booster campaign have been. That's making a real difference in mitigating the risk and helping reduce the spread. Dr. Fitzgerald and her team are working on the public health guidance for children under the age of 5. And our government has mental health resources available to help, all of which can be found on our website. And we know how the Bridge the Gap tool has been a great help to very many across our province during these troubling times. Thank you, Newfoundland and Labrador, for your ongoing patience, your resilience, and your compassion for each other. With that, I'll turn things over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. There are 23 people hospitalized due to COVID-19 severity. There have been 247 new recoveries, leaving 1,487 active cases in the province. Since the update yesterday, we are reporting 210 confirmed cases of COVID-19 in the province, 154 in Eastern Health, 26 in Central Health, 13 in Western Health, and 17 in Labrador-Grenville Health. 748 tests were completed since yesterday, with just under 490,000 tests completed to date. Sadly, we are reporting 2 new deaths due to COVID-19 today, and we extend our condolences to the loved ones of these individuals. Public Health monitors the COVID situation daily to evaluate the impacts of restrictions on transmissions and hospitalizations. And while new restrictions just came into effect yesterday, it has been a week since those decisions were made. And while a week may seem short, in the world of public health and especially COVID, a week of data can help better solidify trends and provide reassurance in the direction we are taking. As we move into year 3 of the pandemic, we are acutely aware that the public health restrictions have taken a toll on many people in many ways. Where there is capacity to ease restrictions, we want to do so in a timely manner. This is the start of children's 3rd week back to school, and we have not seen any significant impact on lab-confirmed cases. We do recognize that lab-confirmed cases do not represent the totality of cases in the province, but they are an important indicator to determine the magnitude of spread. More importantly, we have not seen a change in the rate of hospitalizations. Nationally, the rate of hospitalizations is starting to fall as well, which is the strongest indicator yet that the epidemiology in Canada is trending in the right direction. Based on the relative stability that we are seeing in our province and the trends that we are seeing in other jurisdictions, we feel that we can move forward in easing restrictions by 1 week. Our first change will come into effect 12:01 on Saturday, February 12th, so 12:01 a.m. At that time, faith-based services can move to 50% capacity where the vaccine passport is in place, and 25% capacity where the vaccine passport is not in place. We are permitting this change to happen in 2 days advance of additional changes coming into effect Monday. And that's for 2 reasons. First, most services take place during the weekend, and second, attendees would be well distanced from one another and wearing masks. Effective 12:01 a.m. Monday, February 14th, additional changes will come into effect. At that time, formal gatherings, such as weddings and funerals or any events operated by a business or organization, are limited to 50% of venue or room capacity. Restaurants and bars will be able to operate at 50% capacity with a maximum table size of 10 people with physical distancing between patrons seated at adjacent tables. Eating or drinking is only permitted while seated, and masks may only be removed while eating and drinking. There will be no dance floors permitted at this time. Performance spaces, bingo halls, and cinemas can operate at 50% capacity. Food or drink is permitted, provided physical distancing can be maintained between bubbles. Patrons can remove their masks only when seated and actively eating or drinking. Gyms, fitness facilities, and arenas can operate at 50% capacity, provided that physical distancing may be maintained. For team sports, return to competition that would fall within an organization, team, or group's regular competitive schedule can resume on Monday, February 14th. So, for example, if a hockey league has always been regional in scope, regional competition may be permitted. However, only single games are permitted with teams playing a maximum of 1 game per day. Tournaments of any kind are not permitted at this time. As we return to team sports, please remember that if a COVID exposure does occur while in the course of practice or play, where there is no masking or distancing, then participants would be considered non-household close contacts, and those fully vaccinated can follow the modified isolation requirements. We have gotten some questions on that specifically, so just to clarify. Informal gatherings remain limited to 20 people. And with restrictions changing rapidly, it is becoming quite difficult to make the association between the current restrictions and alert levels. So going forward, we will be removing references to alert levels, and instead we will simply post the current restrictions and guidance on our website, as well as any planned and upcoming restrictions that have been announced. For now, all of our public health measures, such as masking, physical distancing, and proof of vaccination where required, will continue to be a part of our lives. As the province reopens, it becomes even more important to get vaccinated to prevent severe illness and help reduce transmission. 80% of children 5 to 11 have received their first dose, as the Premier just said. And while this is very encouraging, we really want to push this number higher to ensure a good level of protection in this age group. And while the vast majority of children with a COVID infection will experience mild illness, the vaccine helps the body to better fight off the virus and can reduce transmission, especially in those first several weeks after vaccination. And reducing transmission is very important as we open up society and begin to transition to living with COVID. Those who have already had a COVID-19 infection should still get vaccinated to protect themselves from getting it again. The evidence shows that vaccination after infection boosts the immune response provided by the infection itself. If it has been 22 weeks since your second dose and you recently recovered from COVID-19, you can get your booster shot after you finish isolation and your COVID symptoms are completely resolved. This also applies to older adults who have recovered from COVID and have not had their booster dose. Older adults were among the first in our province to receive the COVID-19 vaccines about this time last year. That makes it especially important to have your booster dose, as we know vaccine effectiveness does tend to diminish over time. The pandemic has been rapidly evolving from the start, and now is no exception to that. We ask everyone to try their best to stay tuned to announcements and changes as we transition out of this COVID wave. The path ahead is not always clear, but we must walk it regardless. So we ask you to have patience with one another. Everyone is trying their best to make the right decisions for themselves and their families, just as we in public health are trying our best to make the right decisions for the people of the province. Please take care and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now invite comments by Dr. Haggie. Minister Haggie.
Thank you, Premier. To mirror Dr. Fitzgerald's comments, we've seen the numbers are certainly trending in the right direction. And so with that, we've provided some direction from the department to the regional health authorities around long-term care facilities, particularly around visitation. That's been a balance we've tried to strike over the course of 2 years. Each resident can now have 2 support persons visiting. These changes, by the way, will be announced in detail tomorrow for action first thing Thursday morning, as the health authorities need a day's transition to enact these. So each resident can have 2 support persons. They may now leave the facility for family outings and visitation, in addition to the medical appointments and such that we permitted before. It is, however, suggested strongly that when they go out for a family meal, that they do so at a designated household off the resident's visitation list. A popular, indeed, and insistent topic in my own district is a matter of hairstyling in long-term care facilities, and subject to public health guidelines, hairstyling services can now resume in long-term care facilities, providing the stylists are fully vaccinated and follow public health guidelines. Volunteers will once again be permitted in long-term care facilities, providing they are fully vaccinated and follow public health guidelines. In terms of admissions to these facilities, both routine, short stay, respite and transfers can occur. The isolation and testing necessary prior to admission will be outlined in an admission parameters change document that will be published on the website tomorrow in advance of these changes. And finally, group activities in these facilities may occur as long as they adhere to public health guidelines, with the exception of those that involve sharing of food. However, residents of a unit or a wing or a floor of a home are permitted to eat together without the need for physical distancing. We have seen a great deal of stress on family and residents of long-term care. We would expect that these changes will also be mirrored in regulation around personal care homes and community care homes. I think I'll just close the Premier by echoing Dr. Fitzgerald's comment. Having been fully vaccinated and had COVID myself, I went and got a booster, and we've heard from our science table that there is evidence emerging now that maneuver enhances one's natural antibodies and provides even more protection than a booster alone or COVID alone. So with that, get the shot, and I'll hand it back to you, sir.
Well, thank you so much, Minister. We'll now invite questions from the media.
Thank you, Premier. Today, we have 7 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. There will then be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Peter Cowan with the CBC. Peter, please go ahead.
Thank you. This is a question for the Premier and for Dr. Fitzgerald. Premier, you mentioned that you've been receiving a lot more people or messages from folks who are kind of tired of COVID and want restrictions to end. We've seen protests both at Confederation Building as well as the ones nationally encouraging this. How much did this influence the decision to move faster on lifting some of these measures?
Well, certainly we've always followed the evidence, and the evidence and lessons learned from the past have allowed us to move faster than before. Look, 97% of Newfoundlanders and Labradorians have done the right thing. They've obeyed the rules. They've followed the guidelines. They've got the vaccine. That is what has allowed us to get to this place of moving a little quicker than perhaps we could have in other waves. It's the high rates of vaccination. It's the high rates of compliance. We understand that there's frustration. We see that, we hear it, but we have always made decisions based on evidence and based on science, and today is no different. Dr. Fitzgerald?
Yeah, thanks. Yeah, I would agree that, this is based on what we're seeing from our own epidemiology as well as what we're seeing elsewhere and what the science is telling us, what the science around vaccine and vaccine effectiveness is telling us. And so, we understand that the measures that are in place to try to reduce the spread is also, those are not without their impacts as well. And so we want to reduce all impacts that could be influencing people's health as quickly and safely as we can. So that's really what's influenced the decision.
And I want to ask about alert levels and the decision to scrap them. We tried that once before, and they ended up coming back unexpectedly. Can you explain the rationale for why you're no longer going with an alert level system?
Yeah, I think really it's just that it's gotten us, it's been quite difficult. As we developed that alert level system, and I think it's served us very well. And we did it, though, back in 2020 when we were dealing with original COVID. And, we've had many iterations of COVID since then. And what we're dealing with now is different once again, and significantly different, I think, in terms of how we have to approach it. So it's difficult to really have that system apply appropriately at this point. And we felt, we were getting lots of feedback that people were trying to make things fit with the alert levels, and it was just causing more confusion. And so we don't want that to happen. We just want people to be aware of what the restrictions are. So we feel this is probably the easiest and cleanest way to do that.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Whoever wants to jump on this question can, perhaps the Premier or Dr. Fitzgerald. We've recently seen some jurisdictions across the country move towards removing some of their mandates, such as their versions of the vaccine passport. In fact, Alberta is expected to have an announcement on that later today. What does the panel think about those moves in other provinces, and how much does that impact our next steps here?
Yeah, sure. I mean, Richard, I can take first stab, and then Dr. Fitzgerald can follow. We're basing our moves, our progression on our evidence and how we've made decisions in the past. And I think that has led the province to be in a good position. When you look at some of the other jurisdictions, and moving too fast, too quickly in the past has caused significant burden on the hospital system and the hardworking women and men in it. And we can't forget them and the heavy lift that they have done throughout this pandemic, and we need to make sure that we're protecting them as we ease out of it. In terms of specific instruments like the Vax Pass and other things, no one on this panel has ever said that they were going to be permanent, but we do have to evaluate when the right time to alleviate, to get rid of them is, and certainly it's not at this particular second. Hopefully it will be in the not too distant future, but it is not right now. We make our own decisions for our own jurisdictions and don't base it on what others are doing across the country. Dr. Fitzgerald?
I really don't have anything to add other than what you've said. I think that explains it well. Thanks.
And yesterday we had a story with Leila Evans regarding COVID-19 cases at Voisey's Bay. She says people in the area are stressed out about the situation, and she hasn't been able to get very many accurate case counts about the situation. Why hasn't government been able to provide more accurate numbers to the people in that area?
First of all, I think that Dr. Fitzgerald and her team, and frankly, the hardworking people in the Department of Health, have been very transparent with respect to releasing daily numbers and, in fact, the geographic distribution of the numbers. So I'm not sure what the origins of that fear or frustration are. Of course, everyone is frustrated with COVID, so perhaps it's that and some rumors that were swirling around there. But we've been very open and transparent with respect to numbers, and kudos to Dr. Fitzgerald and her team for continuing to do so.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Good afternoon, and thank you. My question is for Minister Haggie, and that's that it was only a little while ago that residents and patients in long-term care homes could have one support person. Now they can leave facilities and get an extra visitor. What changed to be able to make that happen?
Vaccination. It's as complicated and as simple as that. We have significant boosting within long-term care and seniors facilities in general. I think Dr. Fitzgerald has referenced that with the third dose. Certainly we're approaching 80% in the over 70 group. And that has provided that extra layer of protection. We strongly recommend that when they do leave the facility, they do so in a controlled way and have a regard for the recommendations of public health around keeping your contact below 20, a designated household, ideally from somebody off the visitation list. But it is important for us to recognize the struggle that some residents have had with the isolation elements of COVID, and this is a reasonable next step.
Thank you. And my next question is for Dr. Fitzgerald. And that's what Dr. Fitzgerald, you mentioned at the last briefing that we were in a plateau when it came to getting boosters out. Are we out of that plateau? Has that changed to be able to loosen these restrictions today?
So we are seeing, a very slow rise in booster rates, and that's not necessarily surprising. That happened with vaccinations themselves, and so we do have to wait for some people to kind of get to that 6-month mark and be able to get the booster. So it's not really surprising. We it is important at this point, I think, if you are eligible to get your booster, to get it as quickly as you can after you become eligible. It will help to reduce transmission, and especially as we transition into this, out of this wave and into living with COVID, I think that will be very useful. So now, would be a very good time to get your vaccine if you were eligible. But we also want that protection to last for as long as it can, and that's why we have that it's we certainly have good rates that we're seeing in that 70-plus age group, and we're quite happy with. I mean, obviously, I'd like to see them all at 100%, but we're quite happy with where we're seeing the 70-plus age group, but the 50-plus, the 50 to 70 is really where we want to see that increase now, and that's where our focus is. So, if you're over the age of 50 and you can get your vaccine, your booster, please get out there and do it.
Our next questions are from Sarah Antle with Kicker News. Sarah, please go ahead.
Hi there. This question is for the Premier and Dr. Fitzgerald. You mentioned the mental health services that are available to people who need them. I'm wondering if you can speak to how the system is balancing concerns related to COVID and the associated effects on mental health right now.
Well, of course, I think everybody certainly understands, maybe the wrong word, but appreciates how hard this has been on many people, maybe everybody's mental health to a certain extent. And so we have made sure that we have an online system that existed beforehand, but has been very useful, I think, during the COVID-19 pandemic, especially in times of lockdown, where you don't always have access to your primary healthcare provider or your specialist or even friends and colleagues to provide the shoulder that is required. So I think that Newfoundland and Labrador, because it had the Bridges program before, was in a better position than some. But I'll leave specific details perhaps to you, Dr. Fitzgerald. But we all recognize how this has been tough on mental health and addictions across the province.
Yeah, thanks. Certainly, those services are available, and mental health services have been ongoing throughout the pandemic. While my division doesn't deal directly with the mental health services that are available and the operational aspects of mental health services, we certainly have recognized, I think, the importance of supporting mental health throughout this, and there have been groups particularly that have been looking at ensuring that we're addressing those aspects of health, right, of mental health aspects of overall health. So certainly it's something that's ongoing, and I think we're going to have to continue with we're going to see the effects of the pandemic on mental health for some time to come, and so that'll be an ongoing piece of work.
Thank you. And my follow-up is for Dr. Fitzgerald as well. You've been the face of these COVID briefings for the last 2 years. How are you doing? Some days are good, some days not so good. But I think on the whole, the most important thing about being able to do this job is making sure you have a really good team behind you, and I certainly do, both here at the department and in the regional health authorities. The public health teams are astounding, and I really can't thank them enough. And so I think, we're all feeling the effects some days, good days and bad days, but on the whole, it's been good. Thank you.
And thanks for asking.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I'm Dr. Haggie. I have a couple of questions about national research into COVID death that was conducted by a team led by Dr. Tara Moriarty, an infectious disease specialist at the University of Toronto. And I'd like to ask you about one of her observations and one of her recommendations. She says trying to do COVID research in the midst of the pandemic is like trying to fly a plane in the fog. And I'm wondering if that's been your experience and the experience of researchers working on behalf of the province.
Well, I've only ever flown a plane in fog. I've never tried doing research during pandemic, so I'm not sure I can compare the two. Certainly, I would bow to an academic's view of how easy or difficult it is to conduct research there. We certainly have engaged with Memorial and other groups for modeling, for example. We have also engaged with Memorial and supported where appropriate testing studies and research in that area. So I think the other piece of that would probably be best addressed to the academic community, because it's really not something I have any expertise in anymore.
Sure. Dr. Moriarty's conclusion is that Canada is lagging other OECD countries in reporting the number of COVID deaths. Her conclusion is that we're underreporting the number of people who are dying from COVID. And I interviewed her yesterday for a story for the Shoreline News, and I asked her why. She says that it's not willful blindness or anything like that, but she says there's a weakness in the evidence we're using, that we're not testing enough for COVID deaths. And her recommendation is to test every person who dies of COVID, regardless of where they die or how they die. And I'm curious about what percentage of people are we testing now in Newfoundland for COVID?
In terms of folk who die, that would be determined by clinical criteria. So if the individual had concern or generated concern and not had a test while they were alive, that would be done at the behest of the attending physician. More than likely, after that, it would be down to either the regional health authority pathologist, in the case of those individuals who would have a hospital autopsy, or the chief medical examiner if it was done for forensic reasons. I suspect, based on my clinical practice, that the number of the former would be actually quite small. As you raised the issue last week about this individual's research, certainly we are looking at that, but I really can't comment specifically any further about some more of the detail, whether or not we are underreporting and those kind of comments. I think that will await further determination.
And Roger, I think you can't lose sight of causality versus correlation in this whole debate as well.
I don't quite understand what you mean.
Well, there's a correlation and there's causation, and they're two very different things when reporting deaths even. And so, I mean, the insinuation that we're underreporting, it could be just the way that it's recorded. Correlation and causation, especially when it comes to mortality, are two different things.
For example, somebody could have died from Alzheimer's, and also had COVID, but the reporting would have said Alzheimer's. Or
correct.
Or something like that.
Yeah, if you were in a motor vehicle collision, you happen to have COVID, but you died subsequent to your motor vehicle collision, that's a correlation, but not a causation.
Okay, I get it. I understand what you're saying.
Our next questions are from Rastan Farouk Jagal with CBC Labrador. Please go ahead.
This is a question for Premier Furey. In regard to the question asked earlier on regarding the COVID cases of mines in Voisey's Bay, you said that the government has been transparent in terms of relaying the COVID numbers to the public. So keeping you to your word, are you able to tell us the latest numbers of positive COVID cases at the mines in Voisey's Bay and how many people are isolating there?
How many people are at Voisey's Bay, or how many people in Lab Grenfell Health?
Voisey's Bay.
Minister, I don't know if you had the breakdown by...
We're asking the number of positive cases because the individuals, as Dr. Fitzgerald would say, the individuals who work at Voisey's Bay would not be reported on the Labrador Grenfell. They would be reported on their area of residence, assuming they were actually residents of the province. I'm not clear what exactly I'm being asked. Sorry.
What I'm asking, as of right now, the number of people that are isolating at the mines right now, are you able to give me a figure, and also the number of positive COVID cases that have been recorded?
I don't have the information about Voisey's Bay specifically. I don't know whether Dr. Fitzgerald's team would have that, or whether that resides somewhere else.
Yeah, so I don't have the numbers for Voisey's Bay, but I wouldn't necessarily have the numbers for Voisey's Bay. You know, just like I don't have numbers for many other employers in the province. We look at things, on a more regional basis. I do know that Voisey's Bay has been quite cooperative and collaborative with the Labrador Grenfell Health Regional Health Association to deal with this, and much of the testing
thing I think that they're doing is actually their own testing, and that information, it's not necessarily ours to share, but to the best of my knowledge at this point, certainly there is quite good collaboration between the mine site and public health in Lab Grenfell.
And for my follow-up question, would that information being made public be in the public interest?
So I think at this point, if they felt that the information, if public health felt that the information needed to be made public, they would certainly make public advisories, as they have done before. But the mine site itself has been able to, they have a process in place for how they deal with cases and how they deal with isolation, and so I think public health are quite satisfied with that protocol.
Thank you.
Our next questions are from Juanita Mercer with the Telegram. Please go ahead.
This question is for Dr. Fitzgerald. Dr. Fitzgerald, with this further easing of restrictions, what advice do you have for parents of children under age 5 for how to best protect their young children given they can't yet get vaccinated?
Yeah, so I think, parents who have children who can't get vaccinated, one of the most important things they can do is get vaccinated themselves. And that certainly reduces the risk of transmission and within the household. And, all those other things that we do, just making sure you wash your hands well, keep your contacts low. We do know that, the more contacts you have, the more interactions you have on a regular basis, the higher the chance of spread. On the good note is that most children fare quite well. They're often, for many illnesses, are often better than adults in how they manage to get through it. But, at this point, really all of those measures that we have used up to this point is really what we would still recommend. And getting vaccinated yourself as parents is a really important way that you can protect your children.
Okay, and another question for yourself, Dr. Fitzgerald. Parents have taken to social media to notify one another about positive cases in classrooms. They say it so that they can make informed decisions about whether to send their children to school. Do you think that's a good idea, and why or why not?
So I think, parents have it's not for me to say. If parents are comfortable doing that, then I think that's okay for them to do that. We have made our recommendations based on what we feel is appropriate from a public health point of view and a public health standpoint. It's difficult for me or for any of us in public health really to be able to control what people do individually and what groups of people have decided they want to do. What we do know is that the risk is lower in the classroom setting, in that children are wearing masks for the majority of the day. There is cohorting, and we have hand sanitization and there's screening to make sure children are staying home when they're sick. We have a testing program in place for people who are symptomatic. So hopefully catching those cases before they can get into the classroom and spread. So I think that there are a number of things in place to keep the risk low in the classroom. But really it's not for me to comment on what any individuals are doing.
I will now go back through each reporter to see if you have one final question. Peter Cowan with the CBC, do you have a final question?
I do. Can you give us a sense, Dr. Fitzgerald, about the sort of timeline you're looking at for easing restrictions? Do you have a sense of, if things continue as they have been, how long it might take to ease restrictions further?
Certainly at the moment, we're looking at what we're seeing in an offset is, what's happening. It could take 2 weeks for us to see some changes, but I think it depends on a few different things. We're looking at any rates in rise in cases. We're looking at hospitalization rates. We're looking at positivity, keeping an eye on what's happening in, across the country. So there's lots of things that we're looking at. But I think it'd be safe to say that, at the moment we're thinking in 2-week intervals or so, but I certainly don't want to be held hard and fast to that. So.
Richard Duggan with VOCM, do you have a final question?
I do. I've received a question about NACI recommendations for booster shots for teenagers in the 12 to 17 age group. NACI recently updated their recommendations for that group with some conditions. Dr. Fitzgerald, are we doing boosters for that age group here yet? And under what conditions can they receive the shot?
Yeah, so we certainly will be looking at that recommendation from NACI, and I think that process is underway to start that. So it will be children who are identified at higher risk for severe disease. And so at the moment, that's where we're focusing our efforts for booster shots in that age group. And, more information will be available about that in the coming days on our website too.
Ben Cleary with NTV, do you have a final question?
I do, thank you, and I think it's for Dr. Fitzgerald. It's that we're hearing some confusion from parents and students over school sports. With what has been announced today, can school sports practice or compete once again?
Yeah, so this would apply to any sports organization, so yeah, I guess.
Sarah Antle with Kicker News, do you have a final question?
I do, thank you. You just mentioned that performance spaces will soon be open again for 50% capacity with restrictions. There's people working in the performing arts right now who feel that the restrictions for their sector have been stricter compared to others. I'm just wondering if you could respond to that.
So I think, there have been some areas where we have had stricter restrictions for sure. And, we were trying to respond to what we were seeing in the community and reducing contacts as much as possible, reducing the risk of larger outbreaks. I think we've gotten a lot of information about that now, and so we're making these changes right now. So I know it's been really difficult. We understand that it's been difficult for a lot of groups, but hopefully forward is the direction that we're moving. So we should focus on that, I guess.
Roger Bill with the Shoreline News, do you have a final question?
I do, thank you. For Premier Furey, when you and Dr. Haggie and Dr. Fitzgerald saw, for example, the Omicron wave coming, research produced numbers that said this could be the impact. Here's how many people would be infected. Then there was a calculation. Did we have the hospital capacity? Did we have the beds for it? No. How many people would die? And the decision was made to shut the province down again, or not as severely as the first time, certainly, but to cut back. But now we're coming to the point where we're accepting we can't prevent COVID. We're getting vaccinated, and now we're moving towards opening things up and, quote, with it, like living with the flu. But as you point out, the flu still kills people, thousands of people in Canada every year. So I'm wondering, as we go towards opening things back up, what kind of death rate or numbers are we going to have to accept that come with that with COVID?
Yeah, so first of all, the loss of any individual is troubling to everybody, and no one on this panel, or frankly, I don't think any Newfoundlander or Labradorian would feel that if they lost a family member or someone they loved, a friend, a colleague, that they wouldn't feel pain and sorrow associated with it. To your point about influenza and frankly other infectious diseases across our province, they unfortunately do take lives every year. We are anticipating as best we can, given that this is an ever-changing situation, as you've pointed out yourself in the past, that with the high level of boosters, especially in the vulnerable people, so the people that we know are particularly susceptible to morbidity and mortality, as Dr. Fitzgerald has said, those over the age of 50 in particular, especially those over the age of 70. With high rates of boosters for those individuals, we know that there provides at least a 98% 90% protection against severe outcomes. And some of the early evidence is suggesting that with the high rates of boosters in those vulnerable populations and demographics, that we could reduce it to an influenza-like statistic. I hesitate to use the word statistic, though, because any loss of life is an individual. It's a family member, it's a mother, it's a child. It belongs to somebody, and the person belongs to somebody, and it's a loss that we should all feel collectively.
Thank you.
Rastan Farouk Jagal with CBC Labrador. Do you have a final question this afternoon?
Yep. There's data from the Canadian Institute for Health and Information which suggests that throughout the rates of surgeries across the province have gone down, and particularly when there have been instances of surges after these surges, a lot of these surgeries that were happening, the rate down. As the province grapples with the Omicron wave, what is the healthcare system's capacity to perform surgeries like going forward?
I think that's probably best for the minister, but as I understand it, surgical services, they have been disrupted. As unfortunate as we were with respect to our social circumstances to have this occur over Christmas, in terms of surgical capacity, the ORs do, from my previous life, they do slow down over a Christmas period. So there was some of that, but of course that's extended well beyond there. And a huge shout out to the regional health authorities for being able to navigate that, for the surgeons, nurses, and patients, frankly, who have sacrificed during this time to ensure that we have the hospital capacity to have gone through what we just went through. And frankly, for the frontline people who put down their scalpel, put down their gowns and went and vaccinated people, that's not lost on where we are in the overall vaccine campaign across the province. With respect to specific wait lists as they pertain to specific regional health authorities, Minister Haggie, I don't know if you've had the exact detail. I know that they are returning to normal, but that will take time.
Thank you, Premier. I think it's important also to highlight here that no matter Christmas or Omicron or Delta or the UK variant, emergency surgeries, cancer surgeries, chemotherapy, radiation, dialysis, those services were maintained at their pre-COVID level. The only thing that impacted cancer surgery, chemotherapy in a small way and radiation in a significant way, was the outage of IT from the cyber issues that we had. In terms of restoration of normal activity, I'm advised that whilst there is variation between the health authorities, for example, the pressure point I'm aware of at the moment is that endoscopy is still not back up to speed across the RHAs in the way it was before. In terms of backlog management, I have estimates from certainly Eastern Health, which would suggest that the bulk of the backlog from Omicron will be managed over the next 2 or 3 months. I don't have similar figures yet from the other regional health authorities. There's no doubt it had an impact, but I think those kind of information, that kind of information from the regional health authorities is a testament to how hard and how fast they pivoted and the balancing act that they do run, and I'd like to thank them for it too. Thank you very much, Premier. Back to you.
Juanita Mercer with the Telegram. Do you have a final question?
Yes. This question is for Premier Furey. Premier, one of the big reasons that's been put forward from government when it comes to children being physically present in school during the pandemic is that it's the best scenario for their mental health. Given that there's such concern for students' mental health, will there be any push to get more guidance counselors hired for schools in order to get closer to the recommended ratio of one counselor for every 250 students?
Sure, that's a great question, and certainly something that we've already looked at and provided enhanced guidance counselors already, starting in the return to school in 2020. God, that seems like a long time ago, doesn't it? But it's certainly something that Minister Osborne and others have brought to the table, and we're still working through it. We recognize that this is going to require extra support with respect to our children and their mental health as they emerge from this pandemic in particular.
Thank you, everyone. Premier, would you like to make any final comments today?
Well, thank you all for joining us, and a special thank you to Dr. Fitzgerald and her team in public health who've been working around the clock to provide today's update. We don't say it enough, so thank you, Dr. Fitzgerald. It's a heavy lift that her and her team have done on behalf of all of you, and I also want to thank all of you for doing your part in terms of getting the vaccine, being kind to each other, obeying the public health measures. We are in this place today because of you, and we'll continue to progress out of this in a responsible way, and together we'll get through it. Thanks very much.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
If you have a comment about this program, we'd love to hear it. Email or call us, or send us your feedback through social media.
Hi, I'm Carl Wells, getting ready to record another edition of Carl Wells Point to Point. It's a program where I chat with members of our community, and they talk candidly about their lives and careers, from their earliest dreams to their greatest triumphs. I think you'll find it informative and entertaining. Please join us for Carl Wells Point to Point, right here on Rogers TV.